Hi, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the soundbites. Joining me in studio today is Representative Frances Topper McFawn. I love that, Frances. Does anybody still call you Frances? No? Nobody in your family?
No.
That I know when my mom would be mad at me when she'd call me Patricia. I knew I was in big trouble. Anyway, welcome to the show. Nice to see you. I should say former rep, because Topper just left the State House after, oh my God, you've served approximately 60 years as a public servant with state employment, and that's a long time, Topper McFawn. Thank you.
You're welcome.
Yeah, thank you. That's a good thing. So can you give us a little overview of your background, and if you want to skip into how you got into state service and public service, I should say.
Sure.
Go ahead.
Sure. Let's start right from the beginning. Where does the guy come from? Let's see. My mother died when I was 2 years old.
Oh, Topper, sorry about that.
She died in childbirth with my sister. And my great-grandfather, who she was living with, they used to have like 4 generations in a house in those days. And so he became my guardian. And he was 84, 85 years old when he became my guardian. And we had a cousin from Ireland, that Elizabeth, that I thought was my mother, and I thought he was my father when I was growing, tiny.
Right.
And when at the appropriate time they told me what the story was, and so that's the beginning of everything. He taught me I used to sit next to him all the time in my little blue chair, and he taught me 2 things that really, really helped me in life. One was, don't judge anybody the first time you meet them. They may be having a bad day, they may be sick, anything could be there. So don't do that. Get to know them before you pass any judgment. And the other is keep your mouth shut. Listen.
Good advice.
Listen
Right.
before you make any statements or proclamations. So I've done that, and it's really helped me in life.
Being a good listener is not easy.
No, it isn't. It isn't. And from that, he died when he was 98, and a couple of years before he died, I had an aunt and uncle that he left me the house with no will or anything. He just said, this is your house to live in. He let everybody could let him know that. But you know how families are.
Yeah, right.
So there was a little argument about that, and we got that settled through court. And but anyway, an aunt and uncle moved in with their 6 kids.
Oh my word.
And life was not easy. We were as poor as church mice. I mean, it was just terrible.
And how old were you at this point?
I was about 13, somewhere around there. Just going to go start in high school. And it was my freshman year, as a matter of fact. And my freshman year, I was taking care of him most of the time. So what they did is they gave me tests on everything. And because I didn't go to school half the year. And I passed the test, so I got through my freshman year. But anyway, that's how it all started. And
where was this? I don't think you.
This was in Cambridge, Massachusetts.
Oh, Cambridge, right.
Yep. And fast forward, I was lucky. I was gifted to be a good athlete. And in high school, I led in 4 sports. I was captain of 3 of them.
Wow.
And then I got out of high school and I worked in a factory. And my job was there was a mattress factory, and my job was as the mattress came down the chute, it would fall flat, and I had a magnetic hammer and a whole mouthful of tacks.
Oh, dear.
You know that white thing that's on the bottom of mattresses?
Yeah,
it's
you did
thin.
that.
Bang, 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 like that, all day long.
Oh, my word.
Well,
no wonder you didn't swallow a few.
Well, I didn't. I didn't like it. Mouth was it was terrible after you had done the day. But the thing that bothered me most about it was you'd be sitting on the loading deck and having your lunch and so on. Well, that was the only, that was the time for the discussion and all that.
Right.
And on Friday, payday, everyone would rush out and get on the MTA and down to Wonderland dog track. So Monday morning, you would hear the story, the repercussions of them losing some of their paycheck.
Right.
And my wife this and my wife that, and my old lady this. And I said, man, I don't want to live this way.
Right.
So I had enough of that stuff, growing up. So anyway, I decided we got to do something about this Topper. And one day, Jimmy Higgins, we're going to call him Bagger, there were three of us that played at BU together, came from the same neighborhood, Irish neighborhood, and that was very unusual. So one day Bagger said to me, Top, I think we need to figure out what we're going to do with our life. And I said, yeah, I think we should before.
This can't be it.
This can't be the way, right. Because all we were doing is getting in trouble and raising hell and everything. So anyway, we decided we'd go to school. So we went to prep school, went to a big name athletic prep school. It was New Prep. And I played 2 sports there. That's what saved my life.
Yeah, the sports.
Sports. Then after that, I got out of prep school and I said, well, we're going to go to college. So I went over to BC, I went to Harvard, I went to Mall. I got accepted at all of them, and except Harvard. And the reason I didn't get accepted at Harvard, because I had a scholarship, a Cheney scholarship for kids, low-income kids that grew up in Cambridge. I could have gone there for nothing. And the reason I didn't get accepted is because the headmaster felt that I was from the wrong side of the tracks.
Oh, lovely.
So I let him know how I felt about that.
Right.
All I needed was his letter of approval. Everything else was done. I was in. And anyway, so that didn't go. And so Bagger and I was sitting one time, we're just sitting talking. Bennett, too. My son's named after him. He was captain-elect of the BU hockey team when he got killed in an automobile accident.
Oh, dear.
Yeah, it was tough. Anyhow, we decided to go over to BU and talk to the coach and see what he had to say. Well, it was very interesting because the coach said when we walked, after we got through the front of the thing and all that and into his office, he said, I was wondering when you guys were going to make a decision what you were going to do. And we said, well, we'd like to come here, And he says, okay, here's the deal. And he starts taking his pen out and he's writing on a piece of paper. You get out to the financial aid place and you do this and you do that. And I says, oh, Coach, what do I have to do to get, he said, all you got to do is play hockey.
There you go.
And he said, but there's some rules. You can't smoke, you can't drink, you got to eat with the team, you got to do this, you got to do that. And I said, whoa. That's not me. In those days, So anyway, he said, well, we'll take care of that. Don't worry about it. And the woman that was outside that we had to get through to get to him, he says, take him down to the financial aid office. And he wrote a note.
Right.
And he says, we're not going to call it a hockey scholarship. We're going to call it a scholarship.
Ah.
And that, because he, I couldn't meet those rules at that time in my life. Well, guess what?
What?
We get into BU, and we're playing hockey. And I was at all of the dinners.
There you go.
I didn't smoke. I stopped smoking. I stopped drinking.
Just didn't want to be told.
That's right.
There
I guess
you go.
so. It was terrible. Anyway, so then that's where I met my wife.
Oh,
She was going to Emmanuel at the same time.
nice.
And I met her on a blind date. And first date we went out, we went to the area where you go parking at Spy Pond in Arlington. And she said, I think, I was in the back seat, a friend of mine was in the front. She says, I think we should go outside. And I looked at her and I, what?
Yeah.
Yeah, we're gonna go outside. She said, and she started pushing, you know. So I opened the door and get out, and I was swinging her on a swing set.
Yeah.
And the discussion that we had was unbelievable. I said, this is a different kind of woman.
Huh.
And first date we went on, I mean, the first date after that, and it took me about 3 weeks to be able to go out with her again, because she was so busy. It was wonderful. We went to the Museum of Fine Arts.
Oh.
So we get in there.
Right there.
Topper doesn't know anything about painting or anything, and she's talking about Van Gogh and all these other people, et cetera, et cetera. So we went out on 3 dates, and we went to 3 museums, the Garden Museum, that one, and another one. And I said, you know, in order for me, because each time we went out and we went to the museums, I couldn't communicate with her.
Oh.
So I said, I got to figure this out. So I took my gym class, and I told the head of the gym class that I wasn't coming to class, that I'd come and take the tests, and that was it.
Huh.
So he says, well, that's up to you. You do what you want. But if you flunk any of the tests, tough luck.
Right.
Well, I didn't flunk any of the tests. And I took a course in fine arts at the College of Fine Arts at BU.
Good for you.
So then the next time, the first opportunity I had,
Chapter 1.
I said, I'm going to tell us where we're going. We're going back to the Museum of Fine Arts. And I get into, when I walked in, whoa, this is really nice. And I'm talking about Impressionism and Van Gogh and this and that. And she's looking at me. And anyway, make a long story short, after that, things got a little bit better.
Good.
And
Well, you chose
so we ended
wisely.
up, oh yeah, I did.
Yeah.
And we ended up here. She's from Vermont. Her father, John Howland, was a state senator. Her grandfather was a House of Representatives, and he was a state senator, and he was also a judge.
I know that name. My goodness.
John Howland.
Yeah.
Yeah.
I didn't know that was
That's my father-in-law was.
serious.
And they turned into, you know, people talk about their in-laws.
Yeah.
I loved them.
Oh, that's
They
great.
turned into a mother and a father for me that I never had.
Oh.
I don't even know who my father is. My grandfather told me his name before he died, but that's about it. Never saw him.
Really, you died when you were so young.
Yeah.
My goodness.
Yeah.
So listen, we have to talk about
Okay.
you as a representative.
All right, go ahead. But that's how I got here.
No, that's so cool. But all right, so and I have a list here. I may not read them. Well, I'm going to read them all because you have a lot of community service in your background. Board member of the Central Vermont Economic Development Corp.
I was president of it, too.
Oh, were you? I don't have that down. Yeah. Board member emeritus, sorry. Barre Area Development Corp.
I was president of that, too.
My gosh. Member emeritus, Central Vermont Workforce Investment Board, president.
I founded that.
Did you really?
Yeah.
Now that's cool. Past member, Barrytown Select Board,
I was the chairman of the select board.
Huh. I always had trouble with this word. Member emeritus, Central Vermont Advisory Board, Community National Bank.
Yeah.
Oh, I know.
That's when the Community National Bank first came into town.
Yeah.
They called me up and asked me if they could help spread the word.
That was such a great community bank back in the day. Yeah. Past member, People's Health and Wellness, which is still here and thriving. Their new building is just spectacular. They're over right next to my church. So anyway, so here we are. You are currently serving on the House Committee on Healthcare and ranking member, vice chair.
I was vice chair, yeah.
Yeah, and your Joint Legislative Justice Oversight Committee. Now, I do not know anything about that committee, but could you tell us a little bit about healthcare?
We over, which one you want?
Let's do healthcare first. Your main committee.
Yep.
What's?
Well, basically, we listen to our constituents. We listen to people in the State House. We listen to the lobbyists and so on. And you get some ideas. But the way I did it is I listened to what the people asked me to do. And I use those other people as references. And so during the summer, you do a lot of work figuring out, are there any of these ideas or these issues that you think we can deal with?
Right.
And then I would go back to the people that put the idea in my mind.
Yeah.
And I would work with the Legislative Council to draft legislation to try to satisfy the needs that they had.
Right.
And I'll tell you, one of the most rewarding jobs being a member of the House of Representatives is doing the constituent work and being able to see their lives change because of something
You did.
that you did.
Right.
And you don't need them to be thanking you or anything else.
Yep.
That was all
That's
I
nice.
needed. I'm going to tell you one story about that. I didn't even know this family. I knew the guy, but I didn't know his wife.
Yeah.
And had a stroke. And unbeknownst to me, ran into trouble with the finance people, taxes and stuff like that, because the wife wasn't really involved in the business.
Yeah.
So anyway, make a long story short, I was standing at the polls one election day, and this woman walked out of the polls and walked across and stopped and turned, took a left and turned and started coming right for me. And I'm looking at it and I'm saying, who's this?
Slow down, lady.
I have no idea who it is either. And she came up right close to me and she said, do you mind if I give you a hug? And I'm saying to myself, whoa, what is this? I said, no, I don't, but who are you? And she said, told me her name. And she said, I want to thank you for what you did to help me when my husband had the stroke and couldn't go back into the business.
Yeah.
So she hired somebody else to run the business. But anyway, that's the kind of thing.
That's nice.
You know her life was
Right.
changed dramatically because of that. And that happened a lot.
Yeah, that's great.
And
Well, it's good people felt comfortable to call you. I think,
I got a lot
think
of
there
calls.
are a lot of situations where they don't feel good to call and ask.
yeah,
So,
yeah. No, I got a lot of calls,
That's
a lot of emails. I tried to answer every one of them. I know I probably didn't.
it's hard.
But, when they back up, when you get a bill that's controversial and you've got 150
right.
emails and phone calls, it's awful hard
Yeah.
to get back
Well,
to them all.
was that healthcare involved with good old pricing? I mean, cheaper, that's always the big thing.
Well, yep. Pricing, they were bills that I introduced, or I introduced with somebody else that dealt with pricing. One of the bills was very controversial. It was early on. I worked with a very close friend of mine, Con Hogan, on this one, and Deb Richter. It was a bill that essentially would provide universal health care. I was too early with it. They're doing it now.
Yeah, right.
They're starting to do it now.
Right.
And I was too early with the global budget. Nobody really understood what it was. But I'll tell you this. The summer before I introduced that bill, I traveled around the state of Vermont, and I would talk to anybody that would listen to me. I started out in Morrisville. There were 3 people there, including me and Deb Richter.
That leaves one.
That's who was there.
Yeah.
One person.
Wow.
And when we finished at the end of the summer, my wife and I kept doing it.
Right.
And when we finished, we were up in the Northeast Kingdom someplace in a Grange Hall. And the whole stage was full of hospital people,
Great.
all kinds of healthcare people, insurance people, health insurance people.
Word got out. You're listening.
Well, of course they weren't for it. The doctors were for it. The nurses were for it. So it never went anywhere. But it brought that into the State House. Governor, what was his name? I can't remember his name
What
now.
was it, Snelling?
No.
Snelling it was,
No,
and Dean.
he tried to get the single-payer health care.
Oh, my God, I know who you mean.
Anyway.
Well, it'll come about 2 in the morning.
Yeah,
but
I know
won't
it, I know
call.
it. So anyway, he tried it. He had that consultant from
Right.
MIT.
Right.
And I think he got, I think he got railroaded by that guy. And so it never happened. But now if you look at what's going on in the State
Somewhere
House
close.
with trying to keep all the prices the same for different services,
Right.
things like that, global budgets, it's coming.
Yeah.
It's coming.
Well, the concept always sounds good. I think the one problem here, if I
Is
may,
money.
is that we didn't have enough people to fund it.
Costs too much money.
Yep.
And I knew that.
Yeah.
But I thought the federal government, if we started something like this and did it slow,
Right.
that the federal government would get involved, because that's the only way you're going to be able to do
Right.
it.
Yeah,
and,
right.
and we should have done it a long time ago. We're the only industrialized country in the world
Right.
that doesn't have it.
Yeah. Well, that's what Canada does.
That's what I was trying to do,
Yeah.
start like Canada. They started in a province, started slow, and then it went throughout the whole.
Yeah.
Like, we started this in Vermont, in the United States, a long time ago in Rochester, New York, when other countries were probably
Yes,
doing
right.
it. And it was working, but then people got greedy, the costs went up.
Right.
That was the end of
Well, I
it.
have a friend of mine in Nova Scotia, New Brunswick, excuse me, and he had really bad cancer and still fighting it. And that he hasn't paid a dime, I don't think, because
Yeah.
the country. And the only catch is you have to go where they send you. If they wanted him to go to a certain place, and he had to go there, that's where he had to go. But it was great care and no money. It was a good deal.
I have friends in Canada that say they love it.
Yeah.
Now, you can hear, I hate it, from other people too. But how long do you have to wait for when you're looking in Vermont?
Yeah.
When you're looking to see a primary care
Oh, I
physician.
know, it's incredible, 3-4 months. You could be gone by then,
That's right.
it's terrible. Yeah,
So anyway, we're heading there.
yeah,
But the government, the national government has got to get involved
yeah, they do.
in a big way.
Yeah.
Just take the Medicare program and
And
increase
it's-
it.
Well, that's what most people look at and say, just do Medicare. Yeah, and that works for me at my age.
Works for me.
Yeah, really.
Works really well for me.
Yeah. You do need that extra, because I have the estates plan, so
So
that's
do I.
yeah.
So do I. But in England and other places, people, if they want, they can buy private insurance.
Right,
My daughter's father-in-law is from England. He died now, but he at one time had a bad heart. He had a heart attack when he was working out, and he was waiting for. They stabilized him in the hospital. He was there 3 or 4
Right.
days. Then it was starting to get into a week, and he says, I'm going to use my private insurance, and the same doctor that he was waiting for is the doctor that operated on him.
there you go. Cool. Amazing.
So there's ways to do this.
Yeah. Well, I always liked, I know that some hospitals specialize in certain things, and I think that's the way to do it. Like maybe heart in Burlington, and up north is the, knees and sort of things, and put some money in there to specialize, and
Hospitals,
that's where you go.
yeah, you need to figure that out.
Yeah.
And you also need to figure out how to keep the hospitals going.
Well, that's true.
We've got several hospitals right now that are in deep trouble.
Oh, really?
So we've got look what happened to Blue Cross Blue Shield. Same type of deal.
Right.
They were being charged outrageous prices for the health care that they were paying for. And you know the story on that.
Yeah.
We had to bail them out.
Yep.
And how did we bail them out? We took money back from places that charged them high prices
right,
for certain things, and
Right.
we bailed them out. Now they're on their own.
Yeah.
So
And
so
I
so
think
much
they're
for
struggling.
the Michigan connection.
Yeah. Yeah.
They loaned them money.
Yeah, right. Well, I think they're not as comfortable as they'd like to be, because every time we came up with some new approach, they would change their systems to meet it, and then we drop it and move on to something else. And,
That's correct.
And I think they got maybe over their head a little, because they're a great organization.
Yeah, one of the bills that we were working on this year was a bill that would keep the prices in healthcare.
Yeah.
Keep the prices the same for the same procedure in all of the hospitals.
Yes.
And they're gonna try that out.
That's very interesting, because when dare I say Trump, but when Trump was in his first term, he mandated that you be able to shop around and call a hospital and say, how much will it cost to do my knee? And then you should be able to look up their costing system, but you can't.
No.
Ben Kinsley and I tried for Campaign for Vermont. Burlington was the worst, because, I mean, they had charges for like tongue depressors, and I said, I just want to get my knee replaced. How much? Ballpark, but you couldn't do it, and you still can't.
Yeah, and the other thing you have to do, Pat, is like you said about the hospitals specializing. That's where the specialists belong.
Yep.
In the hospitals. The emergency room has to get straightened out. It can't be a primary care physician practice.
Yeah. And may I say, 6 hours wait is a bit much, and we're proud of it. Oh, you only waited 6 hours? No, that's not good.
Well, yeah, and then if you have a mental health problem,
right?
I'm really disappointed in Central Vermont Medical Center that they got rid of that piece in their emergency room.
Oh yes, right.
Yeah, and I don't know who made that decision, but that was too bad.
Yeah, and mental health is as you probably know from, it's just everywhere. The police have to deal with it.
Everyone does.
And you really need to know what you're doing.
That's right.
I know in the hospital, before things changed, our officers in Berlin would cover them from security, and some of the stories, without naming names or keeping confidential, but somebody would come in, and after he got finished with the alcohol, the mental health part would kick in, and they would have a really tough time. Just terrible.
Yeah.
It's sad.
It is sad. It is sad.
I don't know what the answer is. Have they tackled that at all in your committee this year?
Yeah.
They have anything new and exciting? We always talk about the hub.
Well, some of the things that there was one bill that it was training school personnel, teachers and other people in the school to be able to recognize it, so that you can get that student on the path to recovery.
Right.
So that was a big deal. That passed, I believe.
Well, they're going to be training teachers what to look at. I'm surprised that they're actually just doing it now, because they're sort of the front line, aren't they?
Well, here's how you look at that. The teacher spends more time than you do with your kid.
Yeah, right.
So if you teach them how to recognize that, then you can figure out a way, where the resources are, they get taught where the resources are, what to look for, then they can get that student on the right path with the resources to help them.
Yep.
So that was a big deal.
And a lot of it is the home environment, and sometimes you need to make a call and say, check this out.
Yeah.
Because I was up at a school I won't mention. I knew the counselor, and I went up, and this kid just lost it, and he's kicking the teacher, and he's doing, the words out of his mouth. I have to look him up. And they brought the kid out in the hallway, and they put him in the quiet room, sort of rubber. And then they sent him home, and I'm standing talking to my friend. I'm like, what's going to happen? He goes, he's going to go home, same environment, going to come back, do the same thing, because it's that's what they did almost every day. Yeah. I thought, you can't live like that. Kid needs a break.
That's right.
They need to know what to do.
And just imagine, this was an area that I really was interested in. just imagine what happens if a student has autism as well
Oh,
and acts up,
yep.
and they treat them like that, you know, grabbing them, and
Right, oh,
which
that,
is the
that
worst
sends
thing
them
you can
off,
do.
right? Yeah,
So, you know, we have to deal with that too.
yeah,
And that was an area that I got deeply involved in. And the results of that involvement was, see, I'm like you, I can't remember the numbers of the bills.
I cannot,
I think it was 86, 186, and that provided a way to house these kids.
Oh.
Because what we did, Pat, I don't know if you were around in state government when this happened, when the Brandon Training School closed.
oh, I did, I was in charge of closing it. I was on the team.
All right. I was around at that time,
Yeah.
too. We promised those people those services were going to be provided locally. Now, we did a halfway decent job
Right.
with the kids, but as you know, an autistic kid goes through school,
Right.
and he may be finished 19, 20, in there somewhere, and that was the wall. So they're home with their parent, or they're in another house with somebody else.
Right,
And what's happening now, Pat, is the parents of these kids are aging out. They cannot take care of
Right.
their kid the way they were able to do it
Right.
before. So they need a place to live.
yeah,
So they have a program where
Right.
you can live with somebody else, but now your time depends on what you do, and when you do it depends on that person, period. You have no choice
oh,
whatsoever. And to me, I didn't think that was right. I said,
Yeah.
wow, you're constricting that person's life so much.
yeah,
So anyway, the bill passed. Took a while to get it through,
yeah,
about 3 years, but got it through. And now you'll see like communities springing up are all over the place.
nice,
And you'll see apartment buildings that are being renovated, and they're able to live in there. The services are right there,
oh, great,
so they don't have to go anyplace.
Yeah.
If depending on the level of autism, you can go to work from there. You can, if on the opposite side, if you can't, and you need 24-hour care, you live there. Your services are provided. Your
There you
day
go.
is planned for you. You do other things other than sit and
that
watch
sounds
TV.
perfect.
So that's
At the Brandon
wonderful.
School, they brought somebody up from Texas, a guy who had the specialty of closing
Yeah.
these kind of facilities. So they brought him up, and he and I were talking one day. We were walking. There was a woman there. This is a terrible story. There was a woman there, had a helmet on, and she was there most of her life. And she was no young kid. She was, and I said to him, so and so, I said, "What's going to happen to her?" You ready for this? Because I did share this with people over my head. I said, she's going to die. Because her whole life was in the Brandon Training School.
That's right.
And now you're taking her out and putting her with somebody else after what, 15, 20 years. And that's all he said to her is,
Yeah.
she's going to die. I went, oh my word.
Yeah.
And there you go. I
Well-
remember that to this day. I remember where we were standing.
Yeah.
And I went back and talked to my boss, and I said, I've got to tell you what he said.
Well, depending on who your boss was, I probably knew him. Ray Mulcahy was a good friend of mine.
Yeah.
I used to go down to Brandon Training School
Right.
a lot. And that's why I think my whole life, Pat, my whole working life has been in the areas where if you're successful at doing something, it makes their life better.
Right.
And I devoted myself to that kind of a
Now, when you
work
worked
history.
for state government for a long time,
Yeah.
and then went to legislature. Were you in human services, or where did you work?
Partly. I started off in the Office of Economic Opportunity
Ah.
with Tom Davis,
Yep.
who was a great
Yeah,
guy,
yeah.
great friend of mine. And there were a bunch of us over there that were turned into be all real good buddies.
Yeah.
And so that's where I started. And when Tom's father became governor, Phil Hoff appointed me to the position that I was in. And when Tom's father became governor, he left. And his father appointed me to be the state director of the Office of Economic Opportunity. And that was right up my alley.
Yeah.
Because it was poor people and so on. And if we got time,
we
I would like to tell you
Sure.
a couple of little stories about
We have 22 minutes, but we have
governors that I worked for.
Yeah.
First one was Phil Hoff. Phil asked one time to Governor Hoff. Phil asked one time wanted to see really low-income people. And so an entourage took place with the Commissioner of Social Welfare, John Wackerman, and all kinds of people.
Right.
And here we are in the
help.
motorcade. Yeah, and you pull in. Well, one of the places I took him was to a garage, dirt floor with a crevice made in the dirt, so the water would, when it would rain, would flow down away from the rest of the people that were living in the garage.
Great.
No kidding. Oh yeah, this was a family.
Yeah.
And at the time, we had a housing program that we were into up in Morrisville. And the governor came in and he looked around, and I'm sure he was shocked. And he said, what's that story on that guy over there? Guy sitting, rocking chair.
Right.
So I said, I don't even know. I mean, I brought you here because the local community action agency picked the person out. So he said, okay, well, let's go meet him. So we go over, and he reaches out his hand, and the guy's looking at him. I don't know if the guy knew who he was, to tell you the truth. And anyway, the governor says, well, how you doing? And the guy's rocking back and forth, and he says, oh, I'm doing lovely. I'm sitting here waiting to die. And the governor backed up a little bit, and he said, So he said, well, Top, let's, we got to move on. So off we went. And about 4 months later, this housing project that we had up in Morrisville is where the people would help build their own house. We brought carpenters and electricians and everything in, and they got taught how to build a house, how to do the plumbing and all that. And if they wanted to go on, they could go in the apprenticeship program, and we would take care of that for them. Anyway, make a long story short, 4 or 5 months later, the governor says to me again, I'd like to go out again, see, So I said, well, okay, good. Now, I didn't know this was going to happen, but we got to the housing project, and he saw it in the beginning when, like, maybe 1 or 2 foundations were in, nothing else. So I was there really to show him the housing thing. Well, lo and behold, we're standing at a cellar hole. This was the last house to be built in this particular project in this area. There were others for later. And he's looking down on the hole, and he says, so what's going on here? I said, I don't know, the guy's digging himself out, digging the place out, I guess, a little bit. And I looked down, and I said, man, I know this guy from someplace. Anyway, the guy looks up at us and says, hey, how you doing? He remembered the governor. And he looked up and he says, whoa, the governor's here. And he jumped out of that hole, over the foundation, across the board to get over the space in between. He runs over to the governor. He starts shaking his head. I never believed this was going to happen. I want to thank you so much, blah, blah, blah. It was the guy that was in the rocking chair.
Going to die.
He was waiting to die.
Wow.
Now he's getting ready to build his house.
Because he got something to do and people needed him.
Yeah.
Jeez,
that's one story about Phil Hoff.
Yeah.
That was a good one. Dean Davis. Marjorie used to make breakfast early in the morning. He would call me up the night before and say, look, I'd like to go for a ride. No trooper. No trooper, just me and him. And I would bring him around and show him people that were hurting. And we went to one house. the father made a wheelchair for the son out of bicycle tires and stuff
Yeah,
like that.
right.
It worked okay for him. The governor says, don't we have a program to help these people?
Right.
And I said, yeah, we do. He says, okay. And he says, so he's talking to the family, and the governor says, is there anything else that, well, the guy says, well, we don't have any fuel oil because we can't pay the bill.
Oy.
So the governor says, oh, well, that's too bad. We must have a program for that. He
We
looks
do.
at me, he says, Topper, don't we have a program?
Yeah.
I said, yeah, we do. He said, okay. So we left there. In those days, it was no cell phones or anything. You had to go find a payphone somewhere. So go find the payphone, boom, bing, bing, bing. He says, you call John up. Well, whoever, I can't even remember now who the commissioner was at the
Right.
time. But you call him up and you tell him, no, he got out of the car. And
Oh.
he took the, he said, you call him, get him on the phone. And he says,
This is the governor.
I want, he had the guy's information on the paper, and he's reading it, and he says, I want a new wheelchair delivered here, and I want that guy's fuel tank filled up. Now, we'll figure out how to do it afterwards.
Right, just
But
do
I
it.
wanted that, and
him.
here's the deal. I'm paying for it this first time. I'll pay for it, but you make sure that you look into this person's case and do something for them.
Wow.
That was Dean
Yeah.
Davis.
See, nobody ever hears these
No,
stories.
no one ever does hear
Most
these.
of our governors, if not all of them, they're fabulous.
That's right,
Yeah,
that's
we
right.
don't. They don't like to brag, but they should let us know
But
something.
they do these things.
Yeah.
I'm going to tell you a funny story about Tom Salmon.
Oh, now I know.
I'm in
the gov.
Boston. No, I'm coming up. He's coming up from Washington. I'm in Boston, and I did not know that he was going to be there at the same time at the Parker House that I was.
Oh.
So I'm downstairs in the bar, and of course, when you travel with the secretary, administrative assistant, whatever. And I saw Joe Gemelli walking across the bar, and I said, Joe, what are you doing? He said, the governor's upstairs. And I said, oh. And he says, hey, by the way, you got to do me a favor. He's going to be down here pretty quick. You got all these women here that are around here. And here's what I'd like you to do. I'd like you to get one of them when he walks in the room, have a dance with him, ask him to dance.
Oh, right.
And I said, really? Sure, I can do that. So anyway, we had one of the women that agreed to do it. I went up to the band and I said, I want you to play Moonlight in Vermont.
Oh. And
the governor, after a while, I don't know, 10, 15, 20 minutes, whatever, and he comes and I said, there he is. She goes over and says, Governor, I'd like to dance with you.
Oh.
And he says, what? Yeah, and the band starts playing Moonlight in Vermont. He says, oh, Moonlight in Vermont.
Cool.
And off they, and Joe's laughing, he says, nice going, Tom.
Oh, that's cool.
So there's some funny things.
Yeah. he's a
Another
good
one
guy.
about Salmon. He had a softball team, Salmon Wiggles it was called. I used to be able to fast pitch softball, and I played at shortstop. So we used to travel all over to raise money in different states for projects that the governor in that state had. So we were in Maine one time. We were promised a lobster feed and all the beer we could drink.
Cool.
And we had a bus that brought us there.
Yeah.
So anyway, the time came, the game's over, time came to go home, and Salmon says, where's the other guy? Where's our lobster feed? He says, a staff member screwed everything up.
Oh.
I got some things from McDonald's coming, and I got some beer coming. You can take it home on the bus with you. We had 13 cases of beer. It was Ballantine Ale, and it was warm.
Excellent.
And we had these hamburger things that were cold by the time we got them. So anyway, we took off. We stopped the first, when we got on the road, before we got on the highway, the first bar room we could find. And we asked if he would trade us a couple of cases.
That's great.
And we come home. That's how we come home.
Excellent.
Oh, boy, I'll tell you. I could tell you stories about...
Yeah,
When you work in state government for a long while, you meet a lot of people, and a lot of good things happen, but a lot of fun things happen too.
Yeah. Well, it's a good group. They work hard, and I always feel bad when they take the ration from people that just don't understand. They've got a perception.
Yeah.
These people work and with very little, I don't want to say support, because they have support, but there's not a lot of staff. They they work really hard.
Yeah. Yeah. Well,
I've always loved state government.
Yeah,
and they cook really well.
Oh yeah.
And women bring in food.
Yeah.
Whenever I'd work overtime in motor vehicles, I'd make sure the group downstairs knew I was in.
Yeah, yeah.
So I could share their food. I'd call.
Well,
find some reason to call.
it was a great experience for me. I worked in the Agency of Human Services. I worked in the Department of Employment and Training.
Right.
Now the Department of Labor.
Yep.
I worked in the central office for a long while, and then there was some things that went on, so I had to vacate, let's say, the job I had, which was a good one. And so I left, and I went out in the field, and I managed the Central Vermont office that was in Barrie at the time.
Oh, right.
And at the same time, I also managed the White River office.
Ah.
So I had to go back and forth.
Was this Department of Labor?
No, it was the Department of Employment and Training.
Oh,
the job
Employment Training.
service
Oh, right,
thing.
right.
Yeah. And they were, besides Burlington, they were the two biggest offices in the state.
Yep.
But I had it made because my mother and father-in-law lived in Brownsville.
Oh, there you go.
So when I went down, if I had to go down to, well, I did.
yeah.
Every week I had to be down there a day or two. I sleep there.
That's cool.
It was cool.
Yeah, nice.
But state government was a good job.
Yep.
And I was in positions where I was really able to help people. That
So
made it
when did you leave state government? When?
38 years.
Ah.
Oh, God. I know when I left, because I went into the legislature right after
right.
that. 2004.
Ah, okay. So you were.
I was
you were
elected in
before me.
2004.
Yep.
I went from there to there.
No, you weren't. Was Tom Salmon working at the Employment and Training Office when you were there, the Gov's son? Because that's where I met him when they made me commissioner of.
I don't remember him.
Oh,
I don't
because that's how
remember
I
him.
first met him. He was down in
Sandy
Employment.
Dragon.
Oh yes. I have a great story about her.
Well, we can.
Yeah,
I got a great one too.
not with this.
That's why I had to get out in the field.
They always tell me I talk too fast. I mean, blah 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 blah. And then Sandra was right across the street from the personnel department, and she invited me over. She wanted me to take her place in a conference. And I came back, I said, if any one of you even remotely says I talk fast, I'm sending you over to Sandra Dragon, because she just put me to shame. That and a few other things, with the smoking and the,
She was
booga
something.
booga, whatever she go.
Yeah, yeah.
I just loved
Yeah,
her. She was
yeah,
cool.
yeah.
So tell me about the Joint Legislative Justice Oversight Committee. I don't know what that is.
That's a committee made up of the Commissioner of Corrections. I'm on that. I was on that committee.
Yeah.
Human Services. The chair of that committee. The Healthcare Committee. I was for them. I don't know.
What was their
I can't
focus? The
remember all of
corrections people?
Yeah, yeah.
Ah.
What it is you have oversight over some of the judiciary work that's done, and the corrections department. And I was there watching out for health care for the prisoners.
Yep.
And other people were,
Interesting.
for the services that were provided to the
Yep.
prisoners, and we did oversight to make sure that they were treated properly, number one.
Right.
And number two, that they were able to, when they come out of the institutions, that, in my case, that their prescriptions were set up for them.
Yeah, housing and.
Housing and that kind of stuff.
Right.
Yeah, that was
Yeah.
basically what we did.
You know, there was a thing that Barrie City had, and I went to it. It was a exercise in getting out of corrections. And they would tell you got to get a job, you got to get a place to live, and all this stuff. I failed miserably because it was very hard with nothing to come out and start
right.
your life over again.
Yeah,
it was terrible.
You end up, the recidivism rate was
Yeah.
up
And that was the best way to hit
Get
it
'em
over
back there.
to my head, because this is not easy.
Yeah.
Because you think, how hard is it? Get a job. It's hard. Especially when you had that background,
That's
with
right.
your corrections.
That's right. Well, that was what we did.
Yeah.
Is we talked to the Agency of Human Services people, we talked to the Corrections Department people, the commissioners, and said, these are the kinds of things that have to be
Yeah.
done. And then we would hold them accountable.
Right. That's great.
So-
Yeah.
That's
Because,
basically what that was all about.
We found the one thing that I got involved in motor vehicles is that these people didn't have documentation when they left. Birth certificates, whatever.
Yeah.
Driver's license, stuff that you need when you're going out.
To get a job.
Yeah, and then
or
they
rent
never, there was something about they didn't keep them on file. I don't know what it was. It was very bad for them
Yeah.
to try to start over with nothing.
Yeah, it was tough. And one of the other things that we did is we got services into the institutions to help those people. Some people wouldn't take part in them.
Yeah.
A lot of those people that did take part in them came out and were able to live a
Yeah,
halfway
right,
decent life
right.
after that. But there's a lot of them that didn't.
Yeah.
So that's a tough thing, and especially in today's world with
Oh,
the,
yeah,
with
because
the
I'm sure
drug
things-
problem. Oh man,
Things have changed so much for the correctional people when they left and went in. When
That's
they come
right.
out, they're like, whoa.
That's right. That's
Evan,
right.
Did you find over the years that you've been in the legislature that it's changed a lot? I have noticed, and maybe I'm not in it, but it seems to me that the yours, mine, and the compromise bill doesn't exist anymore. That it's more your bill or no bill.
Yeah.
I find there's not that much of a camaraderie or something, or trying to find make everybody happy with a bill.
Yeah.
I don't know.
Well, when I first went in, I didn't see as much of that. I think it depends on the legislator.
Maybe.
I was willing, more than willing, to work with anybody. I didn't care
Yeah, me
what
too.
was in back of their name.
Right.
As a matter of fact, I used to tell people when they would come to me and ask me if I wanted to sign on a bill or want to work on a
Right.
bill, I used to tell them, I said, look, before we start, I want you to know, and I'm not bragging about this, but most of the time, almost every election, when I went in there, I had two things behind my name, R and a D.
Ah, that's a good
And the
thing.
way I got the R and the D is I was running as a Republican. In the primary, the Democratic Party in town would write me in,
That's great.
and I would get their nomination, and I would accept it.
Yeah.
There was one time that I didn't even know there was a progressive group in the town, but there was somebody running.
In Barrytown?
Yeah, and I got the nomination on a
Wow.
write-in vote.
That says a lot, Topper. That's great.
So, to me, I felt that I was there as an individual to represent
Right.
the people.
Yeah. There's
And
a
it didn't
concept.
matter whether it was a Democratic thing or a
Right.
Republican thing. I didn't care, as long as it was helping my constituents and
Because
the
there's,
Vermont
like you said it before,
population.
there's always a solution if
You work
think
at
hard
it.
enough, right?
That's right.
Yeah.
So I had no trouble. I really didn't. I could work with, matter of fact, I did. I worked with everybody that
Right.
was willing to work with me. Progressives, I mean, when I was leaving the State House, a progressive stood up on the floor of the House and said, we're losing a guy that would work with anybody, even me.
Oh, wow. That's nice.
And I'm not going to mention any names, but this guy his people meant a lot to him.
Yeah.
And there were several things that I worked with him on, and we got through.
Yeah.
So,
They should do a lot more of that, to use you as an example, because I just don't see it as much. Although I remember my first day, I mostly was friendly with Democratic women. Don't ask me why. It was just they were chairs of the committees I was in, and
They were chairs of
and,
the
blah. So I got on the floor and I voted. They all voted yes. I voted no. And I thought, well, that's it. You know, I'm toast. And we always used to go to dinner. So I walk out and one of them says, well, where do you want to go to dinner? And I went, really?
Yeah.
It was I was like, whoa. And we just remained friends. And I said, it doesn't matter what I vote. He says, we knew you were going to vote no. You know, that's what you were going to do. And I said, oh, okay. So we went out to dinner.
Yeah, and it's still that way.
That's cool.
It's still that way.
Oh, okay. I don't get to see this, so I
No,
don't want
well,
to judge.
as I say, it depends on the legislator, Pat. And, you know, I was humbled for those last 2 weeks that I was in the legislature.
Yeah.
It was a very, very humbling time for me because people were standing up and talking from their heart and crying. And I'm sitting there and I'm saying, my God.
Well, you were there a long time.
Yeah,
And,
but you never realized that you had that kind of an impact on people. I mean, I have some very, very good, close friends from the legislature.
Yep.
And when I left, the one thing that I said was, please, please, please keep doing things that help people live the best life they can.
Good.
That was my parting words,
Nice.
for what it's worth.
Good job. So what's the future hold for Mr. McFawn?
Well, as you know, I had to leave.
Yeah.
To my wife, my best friend, needs
She
my
is
help.
that. Yeah.
Needs my help, and I don't know how long it will be needed. You know, if she gets built back up again, she's having you know, a major problem with mobility, and so that's my number one thing right now.
Good choice.
And
Maybe hard, but it's still good.
hey, it's already hard. I'm telling you. I know how much she did now. I'm doing it myself.
Ah.
I know how much she did.
Yeah.
So, and I'm so thankful for her. She changed my life dramatically. Changed
She
it
got you
dramatically.
go to a class on art.
Yeah. Well, she made sure too that I was going to school when we were in college together. You make sure you don't be skipping classes
Right.
now. I mean,
That's
she changed my life.
Well, she's such a lovely woman.
Yeah. Well, she's a wonderful, wonderful person.
Great.
And I can't say enough about her, to tell you the truth.
Well, I told you before, when I love being with the both of you because you can tell it, you can feel it.
Yeah.
And there's not that many couples that emote that kind of
Yeah, a
affection
lot of people
for each
tell
other.
us that.
Yeah, it's true.
Yeah, yeah.
It's true.
Well, hey, I would have, who knows where I would have ended up if I didn't meet her.
Well, she'll keep you in good stead going forward.
She does.
Yeah, Topper,
all the
thank
time.
you so much for being on the show.
We're done?
Yeah, we're done. It's over. It goes
Wow.
fast when you're gabbing. And good luck to the future, and all our love to Marianne.
Thank you
Okay.
very much.
Thank
And
you.
Thanks for having me here.
No, thank you. So listen, this is Pat McDonald, your host for Vote for Vermont, where our tagline is listening beyond the sound bites. See you next week. Bye.